waiting is because, well, I didn't realize that it's 11:41. I thought it was 12:41. So I was here more than half an hour early to pick my daughter up. This is the first time this has ever happened. Rome wasn't built in a single step. But I'm going to say this, it's crazy. I know I haven't really checked in a lot because I've been going to bed early, and therefore some of my late night ramblings and postings have been MIA. But I've made a couple of changes, and one of them was I went dry in October, and I'm still pretty dry right now. Actually, I'm really dry right now, with the exception of a Dunkin' coffee, because Dunkin'. That's product placement. I regularly admit that I am sponsored by Dunkin'. Um, no, but it's been busy, and I know I've been scarce, and the reason why is because life has required a lot of me over the last month, really over the last year. I've got to cut something for an insurance company here in a little bit, and they're an insurance company that I use, and I'm actually very thankful for that insurance company because they've allowed me to live my life and not have to worry about a lot of the things that come along with insurance, because insurance is scary to people. You're just trying to get well, but you can't get well because you have to jump through hoops. And that's the thing that I've learned about insurance is that it's a game. You've got insurance dictating the level of care people can get. Forget what the medical professionals say. The insurance company can override them because they're the ones writing the check. And so people don't get well, or they don't get all the help that they need, or they get told that they have to leave the hospital or a care facility. And I don't know that that's okay to me, you know? And again, I need to do more homework on it. And I'm sure there are a lot of sides to the story. But let me tell you what I've observed. I've observed psychotherapists of mine that don't want to take our insurance for whatever reason. I've observed colleagues who can't afford to pay for out of pocket insurance therapists that they've had for years because it's too expensive now. I've observed people being told that they can't be told about a loved one's care simply because they're over a certain age, but they're in crisis and they're not capable of making certain decisions on their own. I've been told that the insurance company wants to take a treatment plan week by week. I've been told that the insurance can't cover a certain condition of mine because it's pre-existing. I've been told that insurance can't cover a life-saving drug that could help me with weight loss and diabetes management because it's too expensive. These are things I think that are not okay. Now, I'm not saying we need to pay for plastic surgery for people, voluntary procedures. I'm not even saying we should pay for someone else to use a medical procedure as a form of birth control, although they have that choice. I'm saying that it seems to me that the healthcare system has a fundamental flaw. And that fundamental flaw is that it's not looking out for the patient's care. It's looking out for the care of the bottom line, the care of the investor, the care of the stockholder, the care of the bank book. Now, again, I might be wrong, and if I am, feel free to tell me in the comments below, especially if you work in insurance or healthcare, if you're in medicine, if you're a doctor or a nurse, because I'm just a DJ. I push buttons and play songs for a living. I try really hard to show up at 4:30 in the morning. Sometimes I'm not perfect at it. A lot of times I'm not perfect at it. But, that's my plight in life. Your plight in life is to understand all of this stuff and to help make the world a better place. But it seems to me like the Hippocratic oath of do no wrong or do no harm gets thrown out the window when we let certain forms of insurance become involved. And I'm not talking about just paying a copay. I'm talking about waiting on care up until 6 hours before procedure, or waiting on a discharge order up until 10 minutes before the discharge order is supposed to happen, or the discharge is supposed to happen. You know, I don't know. These are the things I've been pondering on, and I probably shouldn't be pondering on them, but I'm not allowed to talk about them on the air because they're uncomfortable. Um, I can't really go into them on the air because, they don't provide an escape. But nonetheless, these are the things that I face as a human being, and maybe you face them too. And if you do, you're not alone because they've kept me up at night. They've scared me. They've caused me stress. They've caused me anxiety. They've caused me to question my own sanity. And I know I can't be alone because it shouldn't be this difficult, you know. Anyway, I'm Toby Knapp, and those are my thoughts on healthcare this morning as I wait on my daughter to get done with her class. A class that's made possible because we've got insurance, but a class which required mad hoops to jump through. Mad hoops. Hoops that could have been better spent getting someone well. You know what I mean? Anyway, I look forward to your thoughts in the comments below. And if you think I'm wrong, tell me I'm wrong. If you think I'm right, tell me I'm right. If you think I have more to learn, teach me. Because it's through learning together that we become better together. So I look forward to what you have to teach me as we go forward. Thank you for watching. On iHeartRadio's Toby Knapp, and I've approved this message. And I hope you're well. And we'll talk again soon. We need to do this more often, you and I.